JScreen, if people aren't familiar, is a program based out of Emory University School of Medicine here in Atlanta. We've been around for about over 10 years now, doing a different type of testing, which we'll talk about, and have more recently focused on cancer genetics. I thought what I would do is talk about some of the myths around cancer genetic testing, and then we'll work our way through that, and then I'll answer some questions at the end. So the first question I sort of answered already is that JScreen is only for people who are planning to have kids. And I know most people are familiar with JScreen for that type of testing, which is to see if your kids are at risk for having a disease like Tay-Sachs or cystic fibrosis. And people use that before they get married or after they've gotten married in planning for having children. And we've been doing that kind of testing for a really long time. But we now have two different testing options. It's not one test, it's two different options. One for people who are planning to have kids, and the other for people who are interested in their hereditary cancer risk. The second myth is that cancer risk is not inherited. I mean, we're going to talk about that, but I want to go into that with more in a little bit more detail. Next myth is that Jews have the same cancer risk as everyone else. This is not true, and a lot of people, I think, joining the webinar already have a feel for that, maybe a family history, but we're going to talk about that more specifically. Next myth, if you don't have a close family history of cancer, you don't need to do cancer genetic testing. We'll touch on that. Another thing that we hear a lot is if your sister or your mom or someone else, close relative, tested negative on a cancer genetic test, you yourself don't need to get tested. And we're going to talk about how the genetics work and why that's not true. A few more myths. One is that BRCA-related cancer risk, if people have heard of the BRCA gene before, that risk only applies to women. Not true. We're going to talk about how that applies to men as well. Another myth, if you did BRCA testing years ago, you don't need to worry about it now. Another myth, and kind of unfortunately, that your doctor will tell you if you need cancer genetic testing. Not always. A lot of doctors don't know so much about this, and you can't always rely on them making that recommendation for you. And finally, if you test positive on a cancer genetic test, all you can do is worry about it. There's nothing you can do. I'm not going to do this testing because now all I can do is worry about it. And we're going to talk about how that's not true. So just to give some background, I think when we think about cancer, really, it's true that the majority of the time that a person has cancer, it's related to factors that are not genetic. So environmental factors, lifestyle, there are a lot of different factors that are not genetic that can increase a person's risk for cancer. You're a heavy smoker, you're a heavy drinker, lots of things that impact that risk. But about 5 to 10% of cancers are inherited. And when we say hereditary, what we mean is that they're actually caused by mutations or changes in what we call cancer susceptibility genes. So there are genes in our body that protect us from getting cancer, but if there's a mutation or change in one of those genes, it increases our risk or reduces our protection, and we're more likely to develop cancer. And an example is the BRCA gene or BRCA1 gene, where if a person has a mutation, is born with a mutation in that gene, their risk for different types of cancer is increased. So, for example, in a woman, her risk for breast cancer is increased from background population risk of about 13% to as high as 80 or so percent for developing breast cancer. That's a significant increase in risk based on that change in the gene. Also, her risk for ovarian cancer in a man, and we talked about this as men and women, with the BRCA1 mutation, his risk for prostate cancer is slightly increased from 12% background to 16%. Also increased risk for pancreatic cancer and even male breast cancer. We talked about cancer in the Jewish community, and I know that a lot of people may have a personal history, may have a family history. And what we do know is that Ashkenazi Jewish men and women are 10 times more likely to carry BRCA mutations than the general population. And again, this increases their risk for multiple different types of cancer. And what that means in numbers is that where a general population may have a background risk of 1 in 400 or 500 for carrying a BRCA mutation, it's 1 in 40 in Ashkenazi Jews. It's about 2.5%, so significantly higher. Also, people don't realize this is not just around BRCA mutations, but there's a very common change in the APC gene that doubles a person's risk for colorectal cancer that about 11% of Ashkenazi Jews carry. So a significant number of people with that slightly increased risk for colorectal cancer based on their Jewish background. So if we think about cancer in a family and who needs to worry about it, a lot of times there's some clues in a family that there may be one of these mutations, people who get cancer early, multiple generations of cancer, rare cancers, 3 or more people with the diagnosis. But the truth is that that doesn't always tell you that you have an increased risk. There are lots of situations where a family looks generally cancer-free, but in fact, there's an increased risk looming there that we don't notice. Why? Maybe there's a small family size. Maybe the family doesn't talk to each other. You know, you don't have a lot of information about your other relatives. Maybe there's a BRCA mutation there and you have mostly males in the family, so some of these cancers haven't shown up. Some people don't talk about cancer. So there are many reasons why something may actually be there and you don't know about it. Look, in the Jewish community, even lots of family being lost during the Holocaust, and you just don't have a really good history of people that may have developed cancer later. The other important thing is that there are lots of genes associated with cancer risk. Let's think about just breast cancer alone. There's the BRCA gene, BRCA1, BRCA2, but there are a host of other genes even associated with just breast cancer. So one of our questions was, or myths was, that if I had BRCA testing, 5 or 10 years ago, that now I don't need to worry about cancer risk. Well, there are a couple of reasons why that's not true. First of all, there are other genes associated with risk, and maybe to update testing will mean testing for these other genes as well. And in addition to that, the technology for even looking at these BRCA genes has improved so much that it would be important to take a new look at those same genes if the testing was done a while ago. There may be more information now. And we're not just talking about breast cancer-related genes, of course. We mentioned APC. There are cancer susceptibility genes associated with over 40 different types of cancer. And here we list some: stomach, melanoma, renal, or kidney, and other types of cancer where there can be a hereditary risk that we can learn about through genetic testing. So when would you use genetic testing and why would it be important? I'm going to talk about it in 2 different ways. One is around prevention, and one is around person who actually has or has had cancer. So let's say that a person doesn't have cancer. There's no current cancer diagnosis. Why would you want to do genetic testing? How could you use that information? And I started talking about this before, but let's say that you do genetic testing and you test positive. I keep using this as an example for a BRCA mutation. What kind of options are there out there for you to either prevent cancer or to detect it early? Well, you could increase your screening. So instead of just having, let's say for breast cancer risk, an annual mammogram, maybe you're alternating those with breast MRIs, which would be a recommendation to look for early signs. Maybe you're having more frequent exams. Maybe for a BRCA diagnosis, that's also an ovarian cancer risk after you've had kids, removal of ovaries. So there are other interventions. Maybe a person would elect to do prophylactic mastectomy to significantly reduce that breast cancer risk. For other cancer genes, there are other types of screenings that you could do. Let's say with this APC change, more frequent and earlier colonoscopy would be recommended to look for early signs so you could catch signs of cancer early or prevent it from happening by removing polyps and this kind of thing. So there are many things that you could do on the prevention side and early detection side if you knew that you had an increased risk for certain types of cancer. And when you test positive for one of these genes, you know which type of cancers you need to be looking for. So let's say a person already has a cancer diagnosis. Why would cancer genetic testing at that point be important? Because you can't do prevention at that point. But there are lots of things that you could do. For example, let's say we find out that a woman with breast cancer has a BRCA mutation. So the surgical intervention might be, instead of a unilateral mastectomy, that bilateral mastectomy is done, and also consider removal of the ovaries. So that information is very important for that person's overall medical care. There are also some medications to treat cancer that work better in a person with certain cancer mutations. So all of this information can be important in a person who's already been diagnosed. One thing that a lot of people don't realize is that this information can also be used for family planning. So let's say there's a family that's just been devastated by multiple generations of people with breast cancer related to one of these genetic changes, and they just don't want to pass that on to their kids. They just want to stop this problem in its tracks and not let that affect the next generation. People have used in vitro fertilization with genetic testing, where egg is fertilized by sperm outside of the body. Genetic testing is done on those embryos, and the embryos that don't have this mutation are used for the pregnancy. And that's a way that families have gotten around passing on that mutation to future generations. And also other ways of getting around the risk, like using an egg or sperm donor who doesn't carry the mutation, or even doing prenatal testing during a pregnancy. So how is this passed down in a family? I know a lot of people are so familiar with Tay-Sachs and cystic fibrosis, where you need both parents to carry a genetic change in order for a child to be at risk. In fact, these cancer gene mutations are generally inherited in a different way, which is called dominant inheritance. And what that means is that if a person has a mutation in that gene, they themselves are at risk, increased risk for cancer. And each time they have a child, that child is at 50% chance of inheriting that change and having the increased cancer risk. 50% of the time, the child doesn't inherit a mutation and doesn't have the cancer risk. So these things are coming down directly in a family. It doesn't take a contribution from both parents, and it could be the mom or the dad. So who should test? Should you test? I mean, historically, professional guidelines were focused on people with a personal or family history. As we said, even without a family history, we know that Ashkenazi Jews are at increased risk for mutations in some of these genes. And guidelines are changing over time, where really irrespective of cancer family history, a person with Jewish ancestry may be interested in seeking out cancer genetic testing. So how does JScreen work? Ordinarily, the way that the program works is people test from home. So what a person would do is go to our website, which is jscreen.org. They would register for either a reproductive genetic test that we talked about, or a cancer genetic test, or both. Spit kit or kits would be mailed to their house. They would spit in the tube, send the sample to the lab, and our genetic counselors would contact them, and we would talk to them about their results by phone or video conferencing via telehealth. And again, when you get on our website, you can see the two different tests that you can order. So what do we test for on the cancer side? We're actually looking at a panel of 73 different cancer susceptibility genes associated with these 40 or more different types of cancer. We like to test people that are 21 years of age or older, because generally a person who's younger than that, there's not going to be anything actionable for them to do to help prevent cancer at that young an age. And this cancer is relevant, again, to men, women, and any ethnic background, not just Jewish. And our testing remotely is available in all 50 states. If a person were interested in doing our reproductive testing, let's say your kids are having kids and are interested in doing this, you would go online and order that test. And we're looking for a lot of different disease that cross all different ethnicities, but particularly cover risk in the Jewish community. And that's for people of reproductive age. So I think I've covered the majority of the, I did. The only thing I wanted to mention is when I said don't rely on your doctor, about recommending genetic testing, you know, doctors are very good at their specialty area or primary care, but not necessarily well versed in genetics or cancer genetics. And sometimes they just, you know, will see a family history and just think about, like, do your mammogram, do your colonoscopy, but may not think about there may be some background, you know, risk in the family that you could actually do some testing for. So it's really important to be proactive if you're interested in this, and you know, sign up and pursue the testing. So I'm going to stop now and open it up for questions. And I do also have SD Rose, one of our cancer genetic counselors, online to help answer questions as well. Or
So Karen,
SD.
we have some good questions in the Q&A. Okay, so somebody asked if they should do the testing even though they've had cancer in the past. So they don't have a current diagnosis anymore. Is it worth it for them to test?
SD, did you want to answer?
Sure. Yeah, so I think it definitely is worthwhile, even though these results won't be used for treatment for a current cancer diagnosis. It could be very useful to know whether there is a genetic reason that the person had cancer. It could be useful for them. So in case they do have some kind of genetic predisposition to other cancers, they can get ahead of those risks. So for example, you know, if somebody had a breast cancer diagnosis years and years ago, and now is found to have a BRCA mutation, they might decide to have an oophorectomy where they remove the ovaries and the tubes to prevent them from getting ovarian cancer. So they could know more about any potential cancers if they're positive. And it can also help other family members. So if they're able to find a reason for the cancer diagnosis, other people in the family could get tested as well. So it's certainly worthwhile for people who've had a history of cancer. Another question that came up was, can you still get breast cancer even if you test negative?
I'm going to let you answer these, SD, because
Okay,
you're talking to
okay,
these people every
okay,
day. Mhm.
sure. So the answer is yes. Karen showed a slide before, I think somewhere down the line, that showed that having a cancer mutation is only, or a genetic mutation is only a small piece of the pie. So anybody could get breast cancer. Only a small percentage of people who have breast cancer have it because of a genetic mutation. So only about 5 to 10% of cases of breast cancer are due to mutations. Most cases are sporadic. They just happen by chance. As we age, we are exposed to more things and we're just more likely to get cancer. So even somebody with a negative result for BRCA or any other of the cancer genes that we're testing for, they can still get cancer. And that's why we recommend that everybody follow their doctor's guidelines when it comes to cancer screening, even people who haven't been tested or who have a negative result. The next question, do we have a few more minutes, Karen?
Sure. A couple
Good.
more
Okay. So
minutes.
another question, yeah, that I see is, if I've had breast cancer, should my 12-year-old daughter get tested? Do you want to take this one, Karen?
Sure. So we really, you know, as I said on one of the slides, we really, um, we don't do testing on minors, and we also like to do testing when that information might be, as I call it, actionable, meaning we give you a positive result and then there's something that you can do on the prevention side. And so a girl who's, or a woman who's even 18 years old, you know, if we told her that she tested positive for BRCA mutation, we really wouldn't start doing monitoring unless there were very young people in the family that people in the family had breast cancer at a very, very young age. We would probably recommend that she start doing mammograms, you know, imaging of her breast, you know, starting at age 25. So anything younger than 21 or so, we wouldn't recommend doing that testing.
I don't
And
think this question here today, Karen, but I've been asked in the past about insurance coverage.
uh,
Yeah, so like, is there any harm or any danger to testing as it relates to insurance?
Yes, I'm glad you asked that question. I did have a slide at the end. So this has been a concern for many, many years. And actually back in 2008, 2009, there was some legislation. This is called the Genetic Information Non-Discrimination Act, which is still in effect, which basically protects a person against discrimination based on health insurance and employment, with genetic testing results. So in other words, if you tested positive for one of these mutations, your health insurance company couldn't drop you, and your employer couldn't fire you because you've tested positive. And this applies to the vast majority of people. On the other hand, the legislation doesn't protect a person who is trying to get life insurance or disability insurance or long-term care. That company could ask you, whether you've tested positive. They usually wouldn't, but they might ask you if you've tested positive. And at that point, they could deny you coverage, or they could charge you more for coverage. But if you already have those policies in place, they can't be impacted. And generally what we tell people is, and this is on our education video prior to testing, that if you're concerned about that, you don't have these policies in place, to get those in place before you pursue genetic testing. And again, then that coverage couldn't be taken away and your rates wouldn't be increased at that point. All right.
More questions.
All right. Thanks everybody so much for joining.